Join in?
Yeah, that sounds great. Thanks, Bob.
Okay, well, I'm honored to have three guests with us today for our presentation on surviving and thriving in the age of COVID this last year. And I'm sure it will be very enlightening. As I mentioned in our pre-conversation, I'm very acquainted with the Michigan Career and Technical Institute. I was just figuring it out, and this coming fall in September, 50 years ago, I started there as an intern in 1970. And so it's,
Wow.
and I was there for almost 28 years before I left and went to Western Michigan University. So I'm somewhat familiar with the at that time it was called the State Technical Institute and Rehabilitation Center, and I had a chance to work a little bit with Beth before I left, and I think Jennifer as well. I think you were there, and that's what, 20 years ago or more.
Yeah.
When I left. So anyhow, I'll be interested to see how things have changed. And to kick things off, we're going to have Jennifer first, and then we're going to hear from Beth. Jennifer is the acting director of the Michigan Career and Technical Institute, and Beth Childress is the president of the Pine Lake Fund. And I probably should explain the Pine Lake Fund because I think I helped get it started back originally in about 1977. It is the foundation for the Michigan Career and Technical Institute, and so it works hand in hand, and it's well, we can tell all kinds of stories about it, but it's been an excellent way to help fund program and personnel to support the institute. And then I've known Eric when AVIVO was the Minnesota Rehabilitation Center. And Eric is director of job training. Did I get that correct, Eric?
Career education manager.
Career education, okay, great. And we're looking forward to hearing about all of the changes and at AVIVO, as it's known. And so to get things started, Jennifer, you want to tell us a little bit about Michigan Career and Technical Institute and some of the things that happened this past year, and maybe some of the strategies that you're planning to go on from here.
Sure. Thanks, Bob. So I'll just start out with a little history of MCTI, kind of identifying who we are and some of the strategies that we adopted throughout this pandemic. Just before this webinar, I was actually on another with the governor, listening to her, updates as to what's going on with the pandemic. It just seems like it's nonstop. So for those of you that don't know, right now in Michigan, we're one of the worst states in terms of COVID. We've got a pretty good outbreak going. I think our positivity rate is about 25% of the folks that are being tested. They said 18, but then another number said 25. So I'll just throw this out here right now. We are not in person. We had to postpone our enrollment 2 weeks. We hit the pause button, but we are planning on having students back on campus on the 26th. So with that, this is, I don't know if my screen is going to let me go. There we go. Bob mentioned that he was here. What did you say, Bob? You were actually, if you started in 1970, that water tower was put up in 1929. So in 2029, that'll be 100 years old. We have been around a long time, and it started with some seed money from W.K. Kellogg, the W.K. Kellogg Foundation. And it just kind of went from there. In 1944, the Department of Veterans Affairs, we used the facility, or the facility was used for rehabbing vets returning for World War II. And in conjunction with, we had an affiliation at that time with Western Michigan University Industrial Arts Program. So long history here of serving individuals with disabilities. This says over 75 years. I think we're probably at 76 or 77. We lost that year. Just can't get it back. But we do focus primarily, our program standards, we're one of actually 8 state operated comprehensive voc rehab centers. The others include Pennsylvania, Maryland, Kentucky, Tennessee, West Virginia, Arkansas, Georgia, and of course, Michigan. We are accredited by CARF. I was looking at Shelley's tagline there, as well as the Council of Occupational Education. In terms of just some demographics regarding MCTI, our average age of student is 18 to 22-year-old, which presents some issues during a pandemic. So that's 84% of our population fall into that age group. 29% of our students are students on the spectrum. And then the next population would be students with disabilities at about with a specific learning disabilities. Everybody here has a disability. That's about 20%. And then I think the next one after that is 18% of our students are students with ADHD. So we are an eligibility-based program, which means that 3-part definition to eligibility. They have to have a documented disability. They have to require services to maintain or obtain employment, and then they have to have the ability to benefit from services. So it was March 16th exactly of last year when we received the notice from our department that we needed to close our doors, which presents a little bit of a challenge. We have 350 students that live in our dorm. So our first thought, that was, how to get everybody home safely. We had parents that were upset that we were closing the facility. I'm sure anybody that's operating a facility at this point has had that. You've got folks that are terrified and folks that are, just the opposite, whatever. So it's really quite a balancing act, but we were able to get everybody off campus safely. And then we kind of just took a deep breath and for about 2 hours, and then thought, we still have to be able to provide services. So this is our learning model, and the 3 main areas for service delivery here at MCTI are skills assessment, which is our voc rehab program, our vocational assessment program, our vocational training programs, and then our skill gap programs. That's what we call our step up program, the remediation programs. So what we had to do essentially was, first of all, it became abundantly clear we were not coming back in person anytime soon. And you guys probably heard about this on the news. Michigan was one of the first states to lock down. Right or wrong, it is what it is. We just knew we had to come up with something to be able to continue to serve our students. So our plan was we needed to capitalize on our existing resources. We needed to make sure that we had a method to communicate with students. We needed to be able to procure resources that we didn't have in place. And then we needed to kind of manage all of this in terms of our accreditation standards. So the first program that we looked at was the Career Readiness Center, which is our vocational assessment program. And I'll tell you, so this is, a lot of the assessments that we use are online anyways. So we use the CASAS, Career Scope, there's a learning style inventory. And when we looked at that, we thought, boy, we really have something here. I think we could transition this program online fairly easily. So those were the resources that we already had in place. So then we looked at what was missing, and we knew student file review was missing, how to package the assessment was missing, How to conduct an orientation was missing. The releases of information that you have to gather, and then the communication with the students. So with the exception of the student files, we were able to put everything online. In the student files, how we handled that was we actually had a system in place where we could scan those files onto our shared drive and lock those down so that only certain people could view them, so that the staff could actually review them from home through a virtual private network. So we managed to be able to, cover that with everything that we already had available. The question became, the biggest question for us became how to package this so that it was in one place and easily accessible for our student population. So it just so happened that 2 weeks prior to the shutdown, I had to sit in for the director of instruction on one of the occupational advisory committee meetings with IT. And I was listening to the IT instructor talk about Moodle. Man, you know, what's Moodle? It's a learning management system, and it's used by colleges all throughout Michigan. I think 80% of the colleges in Michigan use this learning management system. So just by happenstance, it kind of fell in our lap. We have what we need to continue to deliver this program online. So we started with that Moodle system. Luckily, our information technology instructor had experience and been using that for years. So he was a great resource for us as we put all of our staff through the training. You can actually build courses in Moodle as practice. So we didn't practice, we just took our CASA system, our career scope, our Piney Mountain, our learning styles inventory, and then we built a work temperament assessment in there, which allowed us to continue to deliver our assessment program online. We were able to put all of our orientation materials, we were able to put all of our releases, everything that we needed in combination. We did have to do some mail outs, but we were able to put all of that in Moodle and continue to serve individuals. So it was pretty awesome. The takeaway from this program is we ended up, CAS is normally a 5-week program. We can deliver that program in 2 weeks online. We continued to serve just about as many students as we had the previous year. And then we also made it through our CARF survey with this process. So I think they were forgiving with us on a few things, but it was, you know, looking at this process now, we know we probably can serve more individuals at less cost moving forward. So it's really been, this has been something where you look at it and you go, I don't know if we're ever going back to doing something differently. So a few of the negatives for just that VocEval not being in person, of course, you do miss out on the hands-on demonstration of skills. And you do miss out on that adjustment period with the students actually living on campus, learning to be away from home for that first time. So it's not without issues for sure. So that was a big win for us. I'm going to see if I can get this to move forward. Our remediation services goes right along with the career assessment services program. It kind of piggybacks that. That's the remediation program. Very similar story. We found that all of our remediation tools, the math and literacy tools that we had, our employability skills, the computer skills, all of that, all of those services that were being provided on campus could continue to be delivered remotely through that learning management system. So it was, we continued to push people forward. I think we graduated last year, 179 students. So that's about half of what we normally do, but just the fact that we were able to deliver that and keep moving moving people forward was a win for sure. So I talked about the VocaEval piece. This is these are our training programs that we offer, and just real quickly, I'll talk kind of about what each one of the training programs did. It was very similar. Each one of them were able to identify coursework that was missing. The auto program, we were able to procure resources for them to deliver some curriculum online in terms of the CDX learning. Electude is a learning management system for the auto programs. It's pretty interactive. It's tied to the ASE certifications. SB2 with the pollution and safety training. They created PowerPoints and videos in Moodle and uploaded those. And then our staff actually went through and created an auto resource library. So they were able to deliver. Of course, you do lose out on that hands-on piece, but they were able to continue students moving forward, which was our goal. So along those lines, getting back in person was foremost at our mind. So each one of these training programs has a very similar story to auto. We went through and we identified what type of software we could do. Simulators, were those available? So if anybody's curious on those, I can go through each one of the training programs. But when we shut down in March, we also said to ourselves, you know, we are a hands-on institute. We pride ourselves on those hands-on skill demonstrations. We knew we needed to get ourselves back into the building. And I don't know, we don't have, we operate under the state of Michigan, so we don't have the same autonomy that Michigan State would have or Western Michigan would have. So we have to operate under the Office of the State Employer, and so there's not a lot of control whether you open or close. But one of the things they told us was, if you can write a safe start plan, we'll look at it, and if you feel that you can operate safely, we'll look at it and we'll weigh it, and then we'll give you the thumbs up or the thumbs down. So I started probably in July to write this plan, and it went, I don't know how many revisions. We were set to start school in September, and it just, we weren't getting any feedback on the plan. They kept coming back to us saying, what about this? What about that? What about this? And so, you know, we went through things like we had levels of exposure determination, engineering and administrative controls. I've written instructions on hand hygiene, disinfection of environmental services. I procured equipment that would sanitize large areas quickly. Of course, now we've learned that you're not necessarily getting this by touch, but it does offer people peace of mind. We had to address personal protective equipment and clothing, health surveillance, feeling sick, work-related post exposures, follow-up, gatherings, restrictions, returns to the workplace, how to gain or how to grant authorization access to the building, the training that was required for staff. I had to make sure that all staff were trained. I have the PowerPoints for those as well. The daily screening tools that we have to do every day. We have to screen students that were in the building. So all of this, there's a lot more that went on with this, but all of this was in place, had to be in place before the Office of the State Employer would grant us permission to reopen. So we were able to reopen. Normally we start in September. We opened October 12th. So it was a long battle to get us open, and we were one of the only Michigan Rehab, who was our main referral source, they were not back in the office. So we were open. We have a living environment. We have 350 beds in the dorm. We managed to, we held it to about a third of that. We said, okay, if we're going to reopen, we'll keep our numbers low. Everybody will have their own dorm room, their own bathroom, and we'll see how it goes. I will say that we were open from October 12th to right before Thanksgiving, and we closed down and we didn't have any incidents of COVID. So pretty proud of that. But then we went through, we knew we would pause at the Thanksgiving break and stay off campus until after the first of the year, which we did. When January came around, we were having another outbreak from the holidays. We just hit the pause button. We started virtually because everybody had Moodle in place and their learning management systems in place. So we started it online, if you will, for about a week or two, and then we moved to in-person learning, and that went pretty smoothly. So now we're at another, right after spring break, we were starting another term, and we felt we needed to hit the pause button. But again, having that flexibility to offer some of the coursework remotely has greatly helped us. We can continue to move individuals forward. I did just get word this morning that we're going to be able to vaccinate. We are going to be a pod site for vaccinations. So they are going to allow us to vaccinate individuals here. Probably, I think what we figured is 10 days after the students return on the week of the 26th, we'll hold for 10 days, and then we'll start vaccinating those that are interested in receiving the vaccine. That was something else that I worked for staff to do here. I worked with the Berry County Health Department to gain emergency status or first responder status for our staff. So I think we're about 50% vaccinated, and anybody who wanted the vaccine could get the vaccine. So, but we're at about a 50% vaccination rate, and we have 83 staff. So it's pretty decent, but I'd like to see those numbers higher, just from the standpoint of it's not fun to get sick and end up in the hospital, for sure. We actually do have two staff that tested positive for COVID, and one was hospitalized, and I just heard that he is doing well. So was sent home, and will convalesce at home for the next 10 days. So that was like 20 some minutes. Do you want me to keep talking, or would you like Beth to share her experience, Bob, with the Pine Lake Fund?
Yeah. One of the areas I think that we are particularly interested in is the use of Skillsoft. And I know Al Jackson has been a prolific user in your informational technology program, and as well as I believe some of your other programs are using it.
So Al is using it. He did. Where's my notes on Al? Because he is IT is still using EditU and Skillsoft. He's got CompTIA, Labs, Linux, EditU for weekly assignments, Skillsoft, Cisco, the Azure SOAR Teams. One of the unique things too, Bob, that Al is using, or Al has done, is we are actually mailing students kits. Al's putting together the kits to mail out to students that are not on campus, because IT is remote. They volunteered to stay remote to kind of help keep our numbers low. So he's got a series of, when we actually send computers out to the students so that they can work on these at home. It's not ideal, but it's working for now.
That's great. And I think you were also using it in your assessment remedial program, maybe the assessment program, if I remember right.
Yeah, Bob,
program.
they are not using that at this time.
Okay.
They're not using Skillsoft at this time. A lot of stuff has changed, but so I'll throw this out there as well. Paul Molka retired in January. So I'm just starting now to be able to get my head around everything that MCTI is offering from an academic standpoint, in a classroom standpoint. I've had the facility side of MCTI for probably 7 years. So this is getting back into this, the vocational eval and and everything in the educational piece of it is that I can talk to you for hours about septic systems and roofs and and HVAC.
Yeah.
So yeah, we're just starting to get our heads wrapped around that. But with EditU and Skillsoft, there is certainly some value there, and we are looking at. We've got a work team together to kind of reevaluate what was working, what wasn't working, and we're looking to change things up a bit. So this is good timing for me because it's been an educational piece for me.
Jennifer mentioned Paul Molka. Paul Molka was a longtime director who just retired, but Paul Molka was an intern of mine back then. So tells you how long ago I was there.
35 years, Bob.
Yeah,
You worked here, so you were longer than that.
Yeah. So Beth,
Yes.
Beth is president of the Pine Lake Fund. Maybe you could tell us a little bit about what the Pine Lake Fund is and how it helped to support MCTI during this difficult, challenging time.
Well, Pine Lake Fund, you know, fortunately, we have a great public, it's a good example of a public-private partnership. Pine Lake Fund's a 501c3 nonprofit. And one of the things that we do, our board of directors serves as the institutional advisory committee that kind of will guide and also provide for the occupational advisory committees, some of the business connections for MCTI. They also are key with our accreditation with COE in terms of reviewing of plans, et cetera, with the school, but really guiding what trends and career pathways and business connections that we have. The other piece is that the core, and Bob probably could attest to this, but the core of Pine Lake Fund is to be of support and provide resources for MCTI and any innovation and other advances that MCTI has. So currently, one of the things is that we have a 20, they were built in 98 or 89, help me with that. 99, whereas a 20 apartments that are 10 are MSHDA, low income available apartments, all accessible apartments that are available for students. And what we found emerging is that they've become really significant for students who are have graduated and have relocated to this side of the state due to their new employment opportunity. It's also created a really nice vehicle for us to help students gain a credit history, if you will. Anytime anyone wants to go into an apartment or any type of new housing, you must have a credit history, and we can help the students with that at the apartments. During the situation that we've had after the school was shut down due to the pandemic, we found that we had a number of the graduates who were, it was really awesome that they had the opportunity to live in the apartments because they may not have had some place to go home to. That was for students as well as graduates due to illness of family, et cetera, that we were able to provide the housing and continue that housing as long as they were going to stay associated with MCTI. And if they were doing distance learning, we have, you know, the capacity up we have free internet for all the residents in the apartments. So it worked out really well to support all of that technology that the students may have. And some students have quite a bit of technology up in the apartments. We are finding that gaming is a big trend. And anyway, in terms of one of the other things we do, and is kind of a key here, is that Pine Lake Fund provides the employment and placement services for students who are graduating from MCTI. As Jennifer mentioned, when we needed to go remote, a lot of the work that our placement team did and job developers was related to meeting individually and in person with students as they're getting ready to exit MCTI for different trades. It might be the last semester For Al, who is our IT instructor, he likes us to start meeting with his students early on to help them with establishing what their career pathway is going to be and where they may procure employment. And in IT, with some of the exit points he has, we've started earlier with those students, but depending on the trade, we'll engage those students to help with some of the soft skills as well as the resume development and job seeking skills. With our going remote, we too took on the Moodle platform and put our soft skill training, our employment support seminar, we call it. We put that course on Moodle, and our placement staff shifted quickly to working with the students and providing them with YouTube access to different types of things. We had done a research project recently with University of Michigan in terms of for students who were on the spectrum for virtual interviewing. It's a project that was using alternative types of modalities for folks to get that feedback as to how their interview skills were. So we used some of those types of things to do the online. One of the things that has been a benefit as we have brought students back, but at a lower number than what we had before, is that now the students that we are working with that have not procured employment, we've been able to kind of do a weekly update. How are you doing? And have provided them with a lot of links and some of the virtual websites that we all are familiar with that you can do some job seeking or procure employment. But during this period of time, we'd already been doing a lot of virtual interviewing with students prior to our going more remote. And so one of the things, and especially in the state of Michigan, a lot of employers had gone to the virtual interviewing model in being remote. And so we were geared, we were already set to have our students participate in virtual job fairs and with the support of staff if they needed it. We now give students the option that the students can go through our employment support seminar, either online or they can participate in it in person if they are here on campus. So it's given us some flexibility with that. The other piece is that they're given a lot of links to what they can access. We've had a lot of employers reach out to us that as they always have, and our placement rate's 86 to 87%. We have not lost a lot of traction in terms of our outcomes related to placement. And another thing that's been really helpful for the Pine Lake Fund is that when we started to go into the situation where the school was not in person doing training, out of a happenstance, I will say, a family foundation contacted the Pine Lake Fund, and their family was from Michigan and had been very interested and supportive of skilled trades training for individuals with disabilities. And they happened to know of a person who had attended MCTI. Long story short, they provided and will be doing it in perpetuity, donation to Pine Lake Fund to support the distance learning equipment needs, as well as scholarships for students who are interested in obtaining a skilled trade. They will be coming to MCTI next month, and we're very excited to meet them in person because they're on the West Coast and in Florida and reached out to us. So in what we thought were going to be some pretty dark days of us being in this situation, a positive for Pine Lake Fund was that we received a nice donation from a family foundation that's supporting right now one of the students who is doing the distance learning with IT, works at a help desk, is looking to be in management, so we'll be going through CompTIA Plus and CompTIA security, and we were paying for her tuition and the equipment, et cetera, that she will need to do that And so, and we'll be able to support other students with the equipment they need for distance learning. What we found is that the environment that our students have gone back to in some situations is not the best environment for learning. And in our working with students have found that some students are using their iPhones to try to follow through and, you know, do their curriculum, which is really not great. Or they're in an environment where there's families watching TV in the background and it's kind of chaotic for them to try to be engaged. So some of what we're trying to do in supporting the equipment is if they need headsets, if they need, you know, iPads or whatever type of technology they need, that we'll be going through a process or needs assessment process with those individuals and providing that those resources to them.
Well, that's great. I think you had mentioned that something about you were also able to get some COVID relief funding or not?
No, we did apply for that small business COVID that was to help with small business loans, but we were not able to procure that, no.
That's great. Yeah, Beth was talking about the business groups. MCTI was one of the original Project with Industry. I think some of our members are very familiar with the Project with Industry model. And they've extended that to most or all of their occupations. And I think that's been a real strength for the program that you have.
Yes. Mm-hmm. And for placement. Mm-hmm.
And oh, absolutely. So another Project with Industry program that's evolved is AVIVO. That was the Minnesota Rehabilitation Services or Center. So Eric, maybe you could tell us a little bit about what's going on in Minnesota.
Sure. Great to see everybody. Unfortunately, Minnesota's been in the news quite a bit lately, especially Minneapolis. So that's a whole nother issue. Really exciting to hear what other people have gone through. And, you know, I was tempted to just say, yeah, what they did, kind of putting it all together. But AVIVO in some form has been around since 1960, way back with the words you were using, Bob. And then we went to just MRC, and then it went to Resource. And then we rebranded several years ago with AVIVO. And that's where we're at now. We started training, I think it was 1985 with that grant. Does that sound about right, Bob?
Yeah.
When that was, I think we were one of the original with that, right?
Project with Industry, yes.
Yeah. Way back then. Today, AVIVO has 3 basic concentrations: chemical and mental health program. We have a huge housing program, and then the career education and employment services that I'm more active in. So our goal is to try to integrate all 3 of those areas. So somebody, you know, going through an issue can go through some sort of chemical program, get some stable housing, and then go the career education and employment route. We were lucky enough to start a class 2 days before we had to shut down. So that was really, really exciting. Fortunately, a couple of us had been listening to the news, and we had heard, I think the week before that Japan announced they were going to shut down their schools, that 2 million people, students, were going to, you know, not have school anymore. And we kind of looked at each other and said, wait, if they're doing this, this is not a good thing. So we started doing a little bit of thinking, but then found out next Tuesday, you know, this is the last day. Most of our students, participants, did not have technology, might have a older smartphone, but really not much else. So that was one huge issue. So we basically kept the student interest and kept things going the old-fashioned way, through phone and through email. That was really interesting. But we were able, when we did reopen, I'll get to in a minute, we were able to have student return of, it was 80% for one class and 90% for another. So, it was just through some email communication, through phone communication, that they went from March to mid-July is when we reopened in person. So we were pretty happy with that. And then we were able to recruit a few other people for that class too. We reopened going through the whole preparedness plan. You brought back a lot of bad or nightmares there, Jennifer, working on that plan and all the detail they wanted, and working with the state and the state OSHA here, and then our Office of Higher Education. We are CARF accredited also, not COE though at this time. Part of AVIVO was deemed essential workers because of the chemical mental health programs and the housing programs. So that complicated it even further. So our plan includes both essential and then the non-essential. So there was a time when about half of our employees were going in and half weren't. So that was a real interesting period there too. We did have to furlough a few people for a couple months until we were able to bring back, but we were able to bring back everybody that wanted to come back. So during that time, we developed our preparedness plan, got ready to go, and then we had more excitement. That is why Minneapolis is kind of in the news now. So with all the legal and police and riots and looting and all that going on, so we had a little setback there also. But by mid-July, we decided we were going to reopen in person with all, of course, distance spacing, reoccupancy numbers, basically between 1/3 and 50% of where we were before COVID. So that was always interesting from a budget standpoint of, trying to predict what we can do with at 50% capacity, if that. And then we limited people coming into our building to just those current students. So we were able to really monitor, health and staff. We had limited staff coming in, so we just didn't have walk-ins and things like that. Case managers, career counselors met with students off-site, maybe even in our parking lot and that, but they didn't come in the building. And those that came in the building, we did the self-assessment health screening and all those things that you had mentioned earlier there, and still doing that to this day. And we were very, very fortunate too that at our institute, our school, we did not have any COVID cases. So we're really proud of that too. The rest of the organization had a couple. So overall, the preparedness plan was good. And that was a really good exercise, I think. I don't know what it is in Michigan, but every business in Minnesota is supposed to have one. It's kind of interesting to see what some look like and some don't. But the state put together a pretty good template. So if you followed that, but it's really the training of the staff. We spend about a half hour on the first day of class going over COVID safety with the students when they come in to make sure they realize, the priority and the importance of it. And if you see somebody not wearing a mask, you have to wear the mask properly because of you, we might have to cancel class. So, things like that, but it's been really good. We had to get several waivers from the state. Well, they actually brought them out where we could do intakes and signatures and things like that online that they were totally against before. We went the route of Google Classroom. Since we're not technically, we're licensed by the Office of Higher Education, so we're a post-secondary school, but it's not enough to get the EDU designation. So we were able to get an institute designation. And then we were actually able to talk to somebody at Google and get Google for Education for AVIVO. That was a real challenge. Basically for free too. We were able to get some of the CARES relief money through county here, which helped support buying some technology, PPE. We've got the plexiglass shields in front of every workstation. in that. So that really helped. You were talking about that huge sanitizer. Yeah, we had a company donate one, it looks like a huge paint sprayer, size of a little kid's wagon you're pulling along, and now we've tried it a few times, but it's a lot of work to put together, and now, not even really worth it. But we went through all the signage, added, and circles on the floor and things like that to make people feel safe. And a lot of people were really concerned. But what we had found out was our population that we work with, they need the in-person. We still get lots of students that have never really turned a computer on before. Yes, there's still a few out there. So we knew that there was really no way we could go totally online. So we taken the slower approach. We're one of the few training providers up here that are open. Many of them are still, no. In fact, one of them is even putting a tent up outside their building for their staff to meet with clients. Wow. Okay. So we are providing that good service. Our state vocational rehabilitation department, a strong referral source for us too. They're not back to work. They don't expect to be back to the office. Well, we're back to work, back to the office until after Labor Day. But they're referring, people for us. And really the website has been a huge resource for us. There's a lot of people out there just looking for options now. So that's really been a strong source for us. We have employers coming in virtually into the classes. We have a real strong business partnership group, about 100 employers still, and they're looking and wanting to talk to students. We're finding there's a lot of demand we're basically training now in just 3 programs. 2 of them are strictly office related, just general office support. We have a medical office support program, and then an IT support program, A+, Network Plus, like you said. So Skillsoft has been really helpful with the A+ end of it and the Network Plus. Whether or not the student is doing it on their own, but we found really as a review, with all the anxiety, we are a Pearson View testing site, so we give the A+ right here too. So the student is, doesn't have to go to another strange location or try to work within their rules to take it at home, which we had one person try it, and it's kind of interesting. Let's see what else. I think the interesting thing of, I'm so glad, Bob told me about this, and, to hear what others are doing has been really, helpful. I mentioned a lot of the other training providers up here are not providing in-person training, and it's been interesting to talk to different levels of different organizations. One level will talk about how great things are going, and then you get more down into the grass there and you find out the real issues that are happening with switching to distant learning or online learning. And I hear it too when I'm doing recruiting. People are just so grateful that we are in person and we can help them. So, and I know it has to be done safely, but I think if you follow, all those guidelines and that, I think we got a couple great examples just on this call that it can really work. So I'm really glad that we took that route too. And rather than just throwing it up in the air, oh yeah, you want to join a class, here's your EditU account, and, go on there, and we can walk you through a little bit of it, but, it just didn't have the success rate at a lot. But if you can tie Skillsoft in with the curriculum that, we already have, which is what we try to do, it's just been a great resource for all the years that, we've been with the organization. So that's basically what I have. I'm kind of looking forward if there's any questions or other people got comments.
Well, thank you, Eric. And at this point, why don't we open it up to questions or discussions? There was just a lot of great information here from all three of you, and see what other kinds of questions or discussion we have.
So I forgot to mention, but Eric hit on that a little bit, the .edu addresses. Beth, you helped us procure or get those .edu addresses in place for MCTI. That was part of a partnership between Pine Lake Fund and MCTI. So we actually do have .edu addresses for all our students now, Bob.
Oh, that's great.
Yeah, I think we could not get it because you had to, we had to have the COE accreditation.
Yep.
Somebody else, and we did not have that now. So
it was a little bit of it was quite a process,
right,
to get that. And it took a few tries and a bit of time and persistence. It was at first it was a little bit frustrating because it wasn't a quick process, but we got it, so we're great. That's good.
I think one of the greatest accomplishments was when we were actually able to talk to somebody at Google. That was like, whoa, there's real people there.
Yeah.
Janice, Maylin, Scotty, questions, comments? Shelley?
I don't know if anyone can hear now.
Yeah.
But
Yes.
okay, good. I wasn't sure if I was clicking the right way. No, I was going to comment that this has been really great information and nice to hear the amount of dedication that each of you have to your programs and students. It's been wonderful to see that there was so much persistence to make sure that things kept going and was in a good situation for not only your staff and your students to be able to continue on. So thank you for everything that you've done.
Yeah, hi,
Janice,
I want to say hi to Eric. Haven't
Yeah.
seen him for a long time.
Long time. I was just going to do the same thing.
Yeah, I would just add that is all great, everything that I've heard from all of you. We went through many of the same struggles. Kansas,
Janice, maybe tell them where you're from.
Cerebral Palsy Research Foundation, Wichita, Kansas. And like Michigan, we were one of the first states to shut down. We shut down, I think it was about March 13th. And we were closed until May 1st. And we were allowed to reopen, but we had to do all our policies in that amount of time. And there was a lot of concern, people coming in, but we've been very fortunate. We did all the screening. We did our placement services, our job placement services in person, which was, I think we were the only ones doing that. Most of our training's been remote. We have a few people coming in. We went statewide. That was one thing we did with our youth program. It's a struggle, but we, I don't know, I think Eric, you probably know, we had remote training since 2010. We actually had Polycom systems and remote classrooms. So we were very used to remote training. But when all of this happened, we went to Zoom, and the Zoom platform has worked really well. And I don't know how many students across 8 students in about every corner of the state now. These are high school youth with disabilities. Still, it's a struggle. The schools are closed. They're open now, and they're bringing all the kids back in now. So we're fortunate, though. We did get CARES Act funding through the county for a lot of laptop computers, different things like that. We got 10 laptops. We did get the PPP money, which helped tremendously for us when we were shut down. We were going really well when we came up to the shutdown. And then, of course, the training piece of it just pretty much closed down from the youth standpoint for some time. So, yeah, all of those struggles, it's just at different timing, I think, but developing all the policies and continuing to develop the policies.
Mhm.
We were essential personnel, so I never was out of the office. I was considered essential. So some of my staff went home and did teleworking for that period of the shutdown. What else? Now, pretty much all of our organization has been vaccinated. And so we're trying to discover the next steps. We have people who want to not wear masks, that's the first thing. Don't want to wear a mask. Do you mind if I don't wear my mask? Well, yeah, I kind of do, but you're the boss. So what do you say? He's not here, so I'm okay. But so now we're going through all of those policy changes, and I've been kind of in and out on this. I'm working on a federal grant due Monday, so that's why I was a little bit late. But it's good to hear from all of you and hear how you've solved some of the challenges.
Well, yeah, thank you, Janice. Before we leave, we've got a couple of minutes. So maybe, Maylin, I know you've working with the school-aged population. You might give us some perspective on your population. You need to unmute if you're still there. I'm not sure she's there. So anyhow, where do you see these organizations in another year? Are we going to be back to normal, or is there a new normal? Eric, what do you think?
Boy. Regarding the mask thing, we have a little bit easier here. It's still mandated by our governor that masks are required. So it's kind of funny you mentioned it. We do have some staff that think just because you're vaccinated now, why do I need to wear a mask? But we're still enforcing that in the classroom, well, in the whole building. In a year, I see us, let's just hope there's not another one, I guess is the most important thing. I think, I don't like to call it the new normal. I read something where it was called like the new reality or something like that. I thought that was kind of interesting. There was a good article to go along with that too. I think we'll be more in the classrooms, but I think there'll be lots of scares where, who knows what happens when flu season comes around, just a normal flu season, are people going to panic and think it's, a new pandemic, or, how's everybody going to relate to it? Or will people start wearing masks like they do in some parts of the world? And, we keep other, like flu season this year has been almost nothing so far. There's so many unknowns, and just tracking it, daily is a job in itself. And trying to look back at, there's just so much.
Yeah, so mentioning flu and cold, I was just in Michigan last week and visiting my son, who's in charge of automation and engineering for Paragos, which is the world's largest maker of flu and cold kinds of things. And they said that that the flu and cold medication sales were down 90% this year. You can believe that. So we have that to look forward to. Jennifer, what do you see things being like in a year? If you can put your
crystal ball. That's exciting. Might not want my thoughts on this. Actually, I don't know, but I do think that we are in a better position to deliver some things that are coming down from WIOA in terms of apprenticeships, continue to be able to provide the related technical instructions for some of those apprenticeships online, and maybe expanding some opportunities to students who have graduated and want to continue their education, like the individual that Beth had mentioned. So, you know, I do see some lights throughout this process, and that's certainly one of the bright spots. So, but I mean, people are people, and we are. I think we're going to continue to have starts and stops until we get enough folks vaccinated. So it's just, you know, it's our reality, and certainly we've just learned to be flexible and continue to be flexible, but we still have to make the arguments that we have to try to get back to some sense of normalcy, and getting students back in this building, more students back in this building, is something that I won't quit fighting for. So they do benefit from being here, and it's what we're going to continue to do moving forward.
Janice, what about your crystal ball? Where do you see
it's going to be,
cerebral
I
palsy?
think it's going to be very difficult for us. We have some real funding challenges right now, but that's a kind of a political thing with our local school district. But the need is going to be huge for youth with disabilities.
Mm-hmm.
I mean, these programs work, but the school systems are so focused on what am I doing with the regular ed kids, that the special ed kids are going to be just lost. Our summer class, our enrollment is really down because they're all working to get credit recovery, and we would even be okay for credit recovery, but they're working on the core courses. So that's there'll be real opportunities, I'm sure, with the youth, and I don't know about everywhere else, but employment is good here, and it really never slowed down throughout the entire pandemic. When we were shut down and beyond, we've got a lot of employers just crying for people. So, you know, there should be training opportunities for those. So, but I don't know, the funding aspect is a real struggle.
Beth, do you want to add anything to your crystal ball projection?
Well, one of the other things that we do is we have relationships with district offices of Michigan Rehabilitation Services throughout the state. And what we found was, Janice was mentioning, that those staff, Pine Lake Fund staff that were in those offices, continued in-person job placement. Here at MCTI, it was virtual due to the nature of our setting. My question and concern moving down the road, since we're very heavily tied with Michigan Rehabilitation Services, and especially the youth, is that I think, like Jennifer said, we need to push really hard to get students here in person, because for us, there's a wraparound that happens with those students. And a lot of those students are coming from really not great home environments. And what they can get here is such it's a gem, and it's really an awesome thing. And I think so for those students, the more that we can get back, the better for them and their employability and viability. Because this has been a tough year in terms of mental health issues for students in general, but also especially for our students who are coming here and wanting to be able to get some independence and you know, move on to be competitively employed. So.
Well, thank you. Any last comments?
Thanks for inviting us.
I see Min Lee says employment never stops being available.
That's right.
Well, thank you all for participating today. We really appreciate it. Some fantastic information that we'll have on our website for others to view.
Yes.
And with that, we will sign off and say thank you so much for participating today.
Okay, take care, everybody.
Yeah.
All right.
Stay
Thank you
safe.
all.
Bye now.
Thanks. Bye.
Goodbye.